Welcome back. You are watching Velshi and Rule. One of the biggest criticisms of the Senate health care bill is how many low-income people and families are impacted. 20% of Americans are on Medicaid, including 39% of all children and 64% of all nursing home residents. Medicaid also covers nearly half of all births in this country. Numerous groups have spoken out against the Senate health care plan, including the New England Journal of Medicine. In an editorial, the journal says, quote, "The Better Care Reconciliation Act, which is also known as Trump Care, is not designed to lead better care for Americans. Like the House bill that was passed in early May, it would actually do the opposite, reduce the number of people with health insurance by 22 million, raise insurance costs for millions more, and give states the option to allow insurers to omit coverage for many critical health services." So we gathered 5 doctors from all over the country to get their point of view. All of these doctors voted for Trump. Not all are Republicans, but they all made that vote with health care being the driving force behind their decision. You are all doctors, and you all voted for President Trump. Why?
I voted for President Trump, which was an evolving decision, because I thought of the choices available that he was in closer alignment to my philosophy.
So I'm a liberal. I voted Democrat up until this particular election, and my problem was that the conversation in healthcare had become incredibly stale.
I voted for Trump because I had watched what Obamacare had done to so many patients. Obamacare extended Medicaid, and so these people, they've got this insurance card that is worthless.
I vote along party lines. I find myself loyal to the Republican Party.
So I voted against Hillary Clinton. That's why I voted for Donald Trump. And I did that because I've experienced 8 years of the destruction of health care as I know it.
We're in a situation where you've got lawmakers working on this bill, and the president did go out on the campaign trail and say, "I'm not going to cut Medicaid. Your premiums aren't going to go up. Drug prices are going to go down, and everyone is going to be covered." Promises have been made, and Americans have expectations.
If you remove the mandate to buy insurance, a lot of things will happen where people will now use just their common sense, and they'll spend money where it needs to be spent.
Right now, the insurance companies get a set amount of money, right? And they have no great interest in dribbling that out for patients.
Harvard did a study that, based on this bill, 217,000 people could die. And when there's a headline like that, it scares people.
And I'd love that's to what it was intended to do.
So I'd love to take the fear out of this.
All the oxygen in the room is taken up by these studies and these headlines that say that hundreds of thousands of people are going to die because of Medicaid expansion rollbacks. The data is not that clear. It's not climate denial to suggest it. I mean, if you look at the actual underpinnings of where they come up with these numbers, it's absurd.
If President Trump was watching right now, what's your advice to him?
Oh, President Trump. Block granting the Medicaid dollars back to the states.
What's your advice to President Trump? Besides stop tweeting.
I think the I think the lesson of the last 8 years needs to be heeded, in that I think healthcare is too complex, as President Trump knows.
That's right.
No one knew. No one knew.
Healthcare is too complex to have a command and control structure.
What's your advice to the president?
I think that the Senate bill, even as it is, although I'm hoping they'll tweak it and improve it in some areas, is a good start to decentralizing our healthcare system.
Your advice to the president?
So for me, it's put the patient at the center of the equation.
Is that not what Obamacare to do?
It did only in all the rhetoric. It never really worked.
What's your advice to the president on health care?
Aside from letting me control his tweets about health care,
good luck with that.
Yeah. President Trump needs to drop the campaign rhetoric, the repeal and replace. It's dead. It's time to move forward with this, and we need to reach across the aisle.
Oh, what a great conversation.
It was interesting. I mean, the one thing that stood out, it wasn't that any of those people I spoke to felt that the things in the bill were right. They were saying the opportunity for choice. But for those living below the poverty line, if you're a mom who makes $20,000 a year,
you don't have choices.
You don't have choices.
Yeah. So that's interesting, because one of the
net.
doctors said he has witnessed the destruction of health care. And I was thinking about this. If you were middle class, you earn too much money to get a subsidy, but you can't afford the increased premiums, Obamacare is the worst thing that ever happened to you. But we don't think about those people who are on Medicaid expansion and those poor. For them, Obamacare was a lifesaver. And we're just talking at each other. We haven't figured out. These doctors were interesting.
They said something that that you don't appreciate if you're not on Medicaid. They said, well, great, you have a Medicaid card. In some places, it's very hard to find a doctor who accepts Medicaid, as the president said, health care.
What an interesting story. It's complicated.
Complicated. Who knew? All right, any moment.